So this is a quick look at uh, preeclampsia and eclampsia. The website is on the previous PowerPoint. It's yeah, the link is there for you to get to this website. So really, preeclampsia is high blood pressure and protein in the urine in the late second trimester of pregnancy, or anywhere in the third trimester. It used to be called toxemia of pregnancy, and they don't know why it happens. Could be an autoimmune thing. Uh, could be a blood vessel problem. Probably has a genetic uh, basis to it. It seems to run in families, so it's multifactorial in any case. The risk factors are first pregnancies. It seems to be worse if you're having twins. Uh, Probably obesity or age will add to it. Any history of diabetes or high blood pressure or kidney disease, because kidneys really control blood pressure, all contribute to this. Um, it's often silent. They don't feel sick, but what they end up with is is swelling, especially of the hands and the face and eyes, um, feet as well. To make the diagnosis, you need to see a sudden weight gain. Really, gain weight gain in a couple of days, where you're gaining multiple pounds a week. Um, as it gets bad, you get headaches that don't go away because of the blood pressure. You get belly pain on the right side, and that it goes into the right shoulder. So it looks like gallbladder pain, uh, and irritability, but that goes with uh, high blood pressure, decreased urine output, and protein in the urine. It can get bad enough that there's nausea and vomiting. That's uh, can affect the eyes, can cause even a blindness. Um, so really, they're looking for high blood pressure, swelling, and sudden weight gain, protein in the urine, liver enzymes, and low platelet count. So that's that HELP. Uh, um, so what do they do? Uh, if it happens late in the third trimester, they'll probably induce labor and get the baby out right away. Um, so so what they do is they induce labor either with oxytocin or they'll do a C-section. My sister-in-law was pregnant with twins and actually ended up with preeclampsia, and it was really quite bad. And she was 37 weeks along, and it was starting to distress her and the babies. It became a dangerous situation, so they ended up doing a C-section on her almost immediately uh, when it happened. So it really is a medical emergency. Um, if it's mild preeclampsia, they try and deal with it uh, more conservatively in management. So lots of bed rest, drinking lots and lots of water, and trying to limit sodium intake to keep blood pressure down. Taking blood pressure medications. Uh, Oftentimes, what will end up happening is that you will be admitted into the hospital so that they can control, no cheating. Uh, they can control diet and you getting up and moving around. So, um, so as long as the baby is doing well, as long as the fetus is doing well, that's they'll probably manage conservatively. But if there's any test that there's not enough oxygen, not enough blood, if there's abnormal liver function, uh, they they will deliver the baby. Um, so the even after they deliver the baby, you'll still have the high blood pressure for a couple of weeks, but uh, it goes away. If you had it once, you're more likely to have it on a second pregnancy, and it can lead to hypertension later in your life as well. Um, so severe complications could be just bleeding problems, premature separation of the placenta from the uterus, which is a real emergency for the baby. Rupture of the liver because the hepatic portal pressure goes way up. Stroke because of clots, and any of those things can lead to death. So, preeclampsia, fairly common, but it is nothing to be trifled with. Eclampsia, on the other hand, is uh, is all this plus seizures, and these are seizures that re- aren't related to an existing condition. So if a woman with epilepsy gets pregnant and has seizures, it's considered epilepsy, not eclampsia. Um, it follows preeclampsia, so it has all the same lead up symptoms. Uh, so it's saying here all the exact same things. Um, m- Most people with preeclampsia don't end up going to eclampsia. They don't go as far as seizures, but it can. Muscle aches and pains, these seizures, really severe agitation, passing out, becoming unconscious, uh, are the symptoms of eclampsia, and it follows the preeclamptic symptoms. Um, they do a lot of uh, kidney tests with creatinine levels, uric acid levels, liver function tests, platelet counts, hematocrit, because they look at basically kidney function, liver function, and blood. Uh, so what they do is they intervene before it gets to eclampsia. If the preeclampsia gets severe, then they induce labor and they deliver the baby or they do C-sections. Um, Anticonvulsants might be used, but I think that they're a last resort because they will cross the placenta and maybe affect the baby. Um, so all of these things are basically the same as the preeclampsia. So eclampsia is kind of the end result of preeclampsia, um, which is following uh, pregnancy-induced hypertension. So, so it's kind of a continuum uh, that people may or may not progress along. It's one of those things. Everyone with PIH, or everyone with preeclampsia had PIH. Everyone with eclampsia had preeclampsia, but not everyone with PIH will go right through and progress to eclampsia.